Brad, could you help give us some awareness around what are some of the major stress zones for picking up an injury in running and the role that recovery has in trying to avoid these?
The chief categories of running related injuries are really bone injuries, so bone stress injuries, soft tissue injuries, such as tendon related pain or tendinopathies, strains to muscles, and then you've got joint related pain. And how recovery affects the injury risk of the given runner is fairly obvious when we consider it from a tissue level. So if we take the first example there of a bone stress injury, if said runner is not building in periods of downtime for their skeleton to catch up, the loads from running inside our skeleton can be really high, up to, for example, 14 times our body weight in the shin bone, the tibia. Then the accumulation of micro damage, which occurs with running in our bones, which isn't a bad thing, that normally gets remodeled and never progresses. But if an athlete isn't recovered enough, for all those reasons we've mentioned before, too much too soon, not enough downtime between running sessions, all those reasons, then a given bone in a runner's body can head towards a stress reaction or stress fracture. A good example is a well-reputed runner in Australia who just ran the Australian national 10,000 metres. Last year, his Olympic Games marathon in Tokyo didn't go to plan. He developed a bone stress injury. It's in the public domain before that event, and the marathon didn't get completed as a result. Fast forward to 2022, and that runner has just set our national record, and he's now taken a day off a week from his training, whereas he used to run twice a day, every day. So not only has he reduced his bone stress injury risk, he's also just gone through the roof with the best 10,000 metre run any Australian has ever done. So that's a good little practical real life example.